So my name is Isra Hale and I am a doctor who's registered with englandboxing. So one of the doctors on the England Boxing Medical Register.
Brilliant. Now, can you talk me through your session that you held just recently? I know you touched on women's health, but yeah, do elaborate a little bit more.
So we had a session. I was given a slot to talk about women's health. So what I'd like to talk about when it comes to women's health, we talked about the differences in the biology between a male and a female. Okay. We also spoke a little bit about gender, a bit about the differences in sexual development, as well as talking about one of my favourite topics, which is periods. Okay. So we spoke about the importance of periods, what to look out for, what we can do to encourage and normalise. And normalise talking about this really important topic, which can be used as a barometer for sort of women's well-being and health.
Brilliant. And what made you want to go into, this side of medicine, or want to do this talk in particular? Why is it so important to you?
I'm one of sort of a few female doctors who covers sport in for England boxing events. Okay, that in itself is a privilege. Okay, I am not a GP or a gynecologist or obstetrician. So those are kind of doctors that specialise in like female health. I am still a doctor.
So it's still one of your passions, I'm assuming.
Yeah, it's an important passion, because half of some of our athletes, not it's not quite 50%, but a lot of our athletes are female. Okay, and there are those important health differences that sort of the athlete needs to be aware of, and the coaches and key stakeholders need to be aware of. Okay. If we look at sort of the higher level, like in Olympic sport, okay, there is an equal number of medals for females and males at the highest level. Okay, so we need to be able to promote inclusivity in the sport if we as a nation want to produce Olympic medals. Okay, it's not a they say it's a male dominated sport. Okay, we know numbers wise there are more males that compete in the sport at a national level. But in terms of Olympic medals, there is equal opportunity for both the females and the males. Okay, and I think it's an area that it's areas of kind of women's health. It's not rocket science. Okay, some of the things which we spoke about, like the importance of making sure that if our periods stop, or if there's bigger gaps between our periods, that we identify this as kind of being abnormal. Okay. Some of the stuff I'm saying isn't rocket science, and other things we talk about is like eating and kind of eating disorders as a problem in sports where you have to make weight. Okay, and what we can do as coaches, what coaches can do, what officials can do, what the boxers can think about to kind of prevent that. Okay.
And in terms of the conference, have you spoken here before, or is this the first time?
I spoke at the Women in Boxing conference last year, and I think the year before. And I've spoke at a couple of like regional events with female athletes, and mainly we just talk about periods. We talk about breasts, we talk about eating disorders. So it's important that we've also got a male population that the key stakeholders need to look after. So things like overtraining, underfueling, not recovering well. That is a boxer issue. Okay, that is a boxer issue. That is not just a female specific issue. I think that's really important, because we want to treat we care about our boxers regardless of what sex they are.
Do you feel like the taboo around these topics is changing slowly but surely?
I think I think it is. I think it's really encouraging to see when I've delivered this like talks and these similar talks, how forthcoming the coaches are. Of both sexes, or male and female coaches, are of like wanting to talk about it and asking like what they can do and how they can help, and I think it's nice to see. And I think seeing at the younger ages, so the school age kids and the junior kids, I think those are the kind of the harder to target groups, where I don't think it's necessarily it's not necessarily an issue them talking about this topic. Sometimes it's just an issue them talking generally, okay, that as they're sort of growing into themselves. But it's nice to see kind of within the youth and senior community, the boxers are very like open about these topics.